Good morning, everyone. So I'll be discussing about my surgical innovation, the BST glide, which will become a DCR surgeon's delight, actually. So I don't have any conflict of interest or any financial disclosures. So as we all know that the bicanalicular silicone intubation is widely used during lacrimal surgeries all over the world, including external DCR and endonasal DCR. The indications are as described, and this silicone tube placement, it aims at maintaining the anastomotic patency and stability of the canalicular epithelium. But the problem is retrieving the metal probes while doing the DCR is the difficulty part, and this procedure may be traumatic. So there is a need of a tube inserter which would make our life easier. So as rightly said, necessity is the mother of invention. So we have invented this BST glide from the idea that from the back of a spoon, it's like the back of a spoon. So it can be introduced into the nose after creating the lacrimal sac flaps and the nasal mucosal flaps. So the precautions to be taken is that the punctum should be well dilated at the start of insertion with the punctum dilator, and the tip of the glide should be visible at the ostium. So this is how the technique of insertion of this glide. So after creating the lacrimal sac flap and the nasal mucosal flap, this metal tube can be inserted with a silicone tube. The metal probes can be retrieved out with the help of that glide. So we have done a pilot study to compare the outcomes of this novel BST glide versus the conventional technique of intubation during external DCR. We had a sample size of 100 eyes, and the routine steps of external DCR were performed. And the patients were divided into two groups, 50 number in each group. And the inclusion criteria were a primary nasolacrimal duct obstruction, if the intraoperative flap damage was there, or canalicular trauma was there, or distal common canalicular obstruction. The outcome measures were mean intubation time and the total surgical duration, and the intraoperative and the postoperative pain scores. So the results showed that there is significantly less time used in using the BST glide, and the mean surgical duration is also very less, and the mean intraoperative pain score is significantly lesser than the conventional method. So various sets and methods have been described for lacrimal intubation. However, the disadvantages are the difficulty in retrieving the probe and the relative expense of these probes, which in developing country as ours. So our tube inserter is smooth, through which the metal probe can glide easily. It is very cheap, and no chance of false passage is there. It is technically very easy. It is a very simple glide, and there are no complications so far. So to conclude, our glide is a novel, economical, and efficient method of BST insertion during DCR. It can also be used in revision DCR, secondary acquired nasolacrimal duct obstruction, and endonasal DCR. Thank you.
Really an excellent presentation and a very good innovation, I must say. But my question is about the different sizes and the ostium size of the patient. Do you have different sizes of the glide?
No, it is a single.
Can that be used in a pediatric patient?
Yes, sir.
Greetings everyone. In this video,
It's
we aim
around
to
the size. It is made for adult size only, but it is also done in pediatric DCRs.
Okay. Thank you.